So one of the biggest questions we get asked quite often is about vaginal tearing. It's actually perineal tear, which is the area between a lady's anus and her vagina. So up to 9 in every 10 first-time mothers who have had a vaginal birth will experience some sort of tear. This could be a graze or it could be an episiotomy, which is when the area is cut for fast delivery of the baby's head. It's slightly less common for mothers who have had a vaginal delivery before to experience a tear. For most women, these tears are very small, they're minor, and they heal very quickly. There's different types of tears. Some women just get some grazes, and these can be left alone to heal naturally. Some women get a first-degree tear. This means just the skin has torn slightly. Sometimes this will need stitches and other times it will not, but your midwife will let you know. Then there's a second-degree tear. This is when the skin tears slightly and it goes slightly further down to the muscle. Most second-degree tears will need stitches. A third-degree tear goes slightly lower than that and meets the anus, but does not go through the anus. And then a fourth-degree tear happens when the tear goes through the vagina and down through the anus. It's quite uncommon for this to happen. If that does happen, you'll be given an epidural anaesthesia, taken to theatre, and it will be stitched up by an obstetrician. If you do have stitches, your midwife will explain what she's going to do, or your obstetrician will explain what they're going to do. What happens is we examine your vagina with your consent after the delivery of the placenta. You can use gas and air to help you if you find this a bit painful. If there is a tear there, your midwife or doctor will explain which tear it is and what they need to do. They will infiltrate the area with local anaesthetic, so you will not be able to feel any pain. You will feel touch and pressure though. If you feel like it's too painful, please ask your healthcare professional to stop and give you some more anaesthetic. The stitches that are used will dissolve within about 10 days to 2 weeks. We ask you to keep the area clean. This means changing your pad regularly, even if it's not full, just for hygiene reasons. Please don't have a bath or put anything on the area. Try and have a shower and just pat the area dry afterwards. If you're finding that the pain is getting more intense over the course of a few days, please let your midwife know and they can check for any signs of infection. A really good thing to use when you're at home is to put a sanitary towel in the freezer, and then you can pop that in your knickers and it's really soothing pain relief.